This is a protest of healthcare workers from the São Paulo University Hospital to honor nurses killed by COVID-19 in Brazil and demand better working conditions to prevent more death. This intensive care nurse and union activist says a shortage of proper equipment is a basic problem.
It's a pandemic, so every patient coming to the hospital can be potentially infected with the coronavirus. So all workers that have any contact with patients should have access to personal protection equipment specific against COVID, and that often does not happen. Many employees are having difficulties accessing the proper equipment.
According to figures released by Brazil's Federal Nursing Council, as of May 20th, more than 15,000 nurses had been infected with coronavirus in the country, and 137 had died of the disease, the highest toll, they claim, among any single country in the world. Earlier in May, the International Council of Nurses estimated the death toll among nurses across 30 countries at more than 260,000. The pandemic has put considerable pressure on nurses here in Brazil, but their professional associations like São Paulo's Regional Nursing Council, COREM, say working conditions were far from ideal even before this health emergency.
Na verdade, a enfermagem tem aí demandas grandes, né?
There are many important issues and demands we need to deal with to work safely. For example, we need adequate number of professionals according to the number of patients, we need adequate time to rest, and we need to have a decent minimum salary determined for nurses. Because there's not a minimum, many workers need to have more than one job. And now, during a pandemic, we still have many nurses working more than one job.
Nurse Dilva de Oliveira was one of the victims of COVID-19, likely infected at work. Her niece told us Dilva was 56 years old when she died, about 1 week after the first symptoms appeared and following 3 days in intensive care.
Olha, eles são soldados de branco.
They're soldiers in white. If one of my children wanted to be a nurse, I would feel honored because they would care for the legacy of my aunt.
In any war, those on the front line face the greatest danger. In the fight against COVID-19, that includes nurses. And here they say too many are getting sick and dying. Paulo Cabral, CGTN, São Paulo.